So you can forgive people for being skeptical that now we should let our guard down on COVID and just embrace this endemic stage because we've been told to let down before and the virus surged back into our lives. Whether to think this time is truly different, that was the topic of conversation today between our Anusha Roy and one of our go-to experts throughout the pandemic, UCHealth infectious disease specialist, Dr. Michelle Barron.
Health leaders, state leaders, city leaders are now saying that they're starting to treat COVID as an endemic disease. Are we really at the point where we can say that comfortably?
We can actually. If you look at the overall transmission rates, they've plummeted. Hospitalizations have gone down, and obviously the new number of cases that are positive, and those are the two measures that I think we've all been waiting for. The other thing is that they recently published a report looking at how many people are immune to Omicron in the state of Colorado, and it's upwards of 90%.
It feels a little bit like deja vu, right? We've watched case numbers go down, we've watched hospitalizations go down, and we all kind of breathe this sigh of relief, and then COVID comes back with a vengeance. So what's to say that this is different, or could that still happen?
There's no doubt that we could potentially have another surge come back, and obviously that's something that we're thinking about and thinking about how we need to prepare for that. However, the big difference is the level of immunity. If you look back a year ago, we had rolled out vaccines, but we were still obviously very active in that process. Boosters were still not even a thing yet, if you think again about that, in terms of the level of protection that we thought we would need. And so I think that's one of the big differences is the level of immunity that we managed to get either through vaccination or through infection with Omicron.
Early on in the pandemic, even referring to flu and COVID in the same conversation was a no-go. So why is it okay to have that conversation now?
The big difference is what we know now. We think most people now are fully aware of COVID and what it can do. And so I think that comparison to the flu isn't as bad now, although the flu still causes issues. So I think, again, it's our comfort level with it is that we know the flu comes, it's not novel to us, we know what to expect from it. So I think that's the big difference.
So Dr. Barron is saying that it's really important to recognize that people are still going to fall sick with COVID, but the goal is to prevent them from getting so sick that they end up in the hospital or they die because of this. And to be clear about that goal earlier, she said could have been really useful for people to kind of figure out what they were trying to work towards. And the fact that health experts are now talking about the flu and COVID in the same conversation is a sign of getting closer to being able to just live with the virus. And while we are in a good spot, obviously this is a global pandemic. Right? And we've watched a lot of the variants come in from other countries. She said, though, that barring anything completely new that circumnavigates anything that we've had so far, she goes, we wouldn't really be starting from scratch. We might see some of those COVID precautions and rules come back, but we would be starting off in a much stronger position.
I think so many of us were just so ready to be done with masks that like as soon as like a respected doctor was like, yeah, you can be done with this, you're just like, boom, I'm done. Like all of this stuff is not that simple.
Yeah, so Dr. Barron was talking about this in hindsight, right? About how it was almost too simple the way COVID was explained to people. And it was this all or nothing approach. Yes, mask, no mask. Yes, vaccine, no vaccine. That gray area, the nuances of the pandemic weren't really explained to folks, and they could have probably handled it. And it's that gray area that we're probably going to end up living in as COVID does this transition to becoming endemic.
Where we are. Anusha, thank you.